Assalamualaikum. My name is Dr. Muhammad Yasir Iqbal. I have been working as PGR in Gastroenterology Department, Nistar Hospital, Multan, under kind supervision of Associate Professor Dr. Yasir Abbas Zaidi. I'm highly thankful to Pakistan Society of Hepatology 2022, who has given me a chance to have my abstract with the title topic of prevalence of sarcopenia and its relationship with lifestyle in patients with chronic liver disease. First of all, we will discuss about the sarcopenic patients. So, the sarcopenia, the prevalence of sarcopenia and its relationship with lifestyle in patients with CLD. The introduction about this disease, the methods or materials which are being used, the results, and conclusions, and the further work. First of all, background knowledge. What is the sarcopenia basically is? Patients with cirrhosis, they have a worse prognosis if they have the sarcopenia. The sarcopenia basically is it's a syndrome which is characterized by a massive loss of progressive and systemic skeletal muscles loss with a consequence like leading to physical disorder and decreased quality of life. It has a major impact on patients' lifestyle, causing decreased physical capability, poor quality of life, and increased morbidity and mortality. To prevent the processing sarcopenia, exercise and nutrition therapies are majorly used. The purpose of this study was to investigate the relationship between sarcopenia and both physical activity and lifestyle in patients with chronic liver disease. The methods which were was uh, used in this study were the patients were enrolled, about 170 patients were enrolled in this study having CLD, chronic liver disease, more than 2 years. Based on the sarcopenia diagnostic criteria of Department of Gastroenterology, all the patients are evaluated for having sarcopenia or not. Certain physical and clinical parameters were considered to evaluate the overall frequency of sarcopenia in chronic liver disease. The characteristics and laboratory parameters of the patients are then divided into two groups having sarcopenia or not. In order to find technique to prevent sarcopenia in patients with CLD most accurately, we have concentrated on patients' lifestyle interventions. We considered SMI, hand grip strength, and the physical activity in this group to identify whether patient is having a sarcopenia or not. The fundamental results which were concluded in this study were shown that the CLD patients have prevalence of sarcopenia about 12.6% in this study with a confidence level of 95% with the margin error of 5%. Based on this non-probability consecutive sampling, obtained data was analyzed through SSP. The different variables were used in this study, including quantitative variables like age, body mass index, duration of CLD, duration of sitting and lying, mean, and the standard deviation. The qualitative variables which were used were like gender, employment status, smoking status, and the sarcopenias were presented as a frequency and the percentages. Conclusion of the study was the patient having sarcopenia and lesser physical activity, they were having the increased morbidity and mortality, and they were also influenced by the employment status significantly. Sarcopenia can be predicted independently by age, BMI, and the physical activity. Lifestyle interventions may be beneficial to prevent sarcopenia in patients with chronic liver disease. The method I have already mentioned, we have enrolled 170 patients according to WHO sample size calculator. We have used the demographic data of patient including age, gender, employment status, BMI, and duration of CLD, smoking status, time spent in sitting and lying. All the patients have undergone CT scan targeting the lumbar vertebra L3 to have the skeletal muscle index calculated. And using SMI and hand grip strength, the patients are categorized as having sarcopenia or not. All the data was recorded and on the performer, and the results were obtained, and the results obtained were entered in the SPSS and analyzed. Variables I have already discussed. These variables were used with the post-stratification chi-square tests are applied with the p-value of less than 0.05 was taken as a significant. These were the results which are shown in my study, including the patient's age, gender, physical activity, liver disease, exercise, and other conditions. The conclusion in this study were the focus in this study. We have mainly focused on the prevalence of sarcopenia in its relationship and lifestyle in patients of CLD. Based on the demographic data, the patients are assessed and classified in physical activity and their habits. The method identified that the 12.6% of sarcopenia, the CLD patients have sarcopenia with a confidence level of 95% and margin error of 5%. Aiming that the study can be used to accurately predict adverse outcomes in future studies with a huge database. We have basically its conclusion was that the CLD patients in the sarcopenia is most common in CLD patients. We have to use many studies have to be conducted in patients with CLD due to their clinical implication, but on appropriate, we have to define the appropriate definition of sarcopenia and its optimal protocols still have to be established. In addition, specific cutoff values for measuring the muscle mass and muscle functions in CLD patient needs to be identified. We hope that the standardized working definition for patients with CLD can be identified that can lead to accurately predict the adverse outcomes in future. Thank you for listening. Hope to see you in PSH 2022. Thank you.